Emotional after those birthday wishes at all. Somebody was chopping onions next to us. Happy birthday, Abigail. All right, let's get into our baby talk for this morning. Let's talk healthy teeth. Very, very important to your baby's overall health. And they help your baby to eat as well as to form sounds and words. And of course, good oral care also helps to set dental habits as your baby grows. So we have the opportunity right now to chat to international dentist Dr. Walid El-Saady to find out how we can better care for our baby's teeth. Dr. El-Saady, thank you very much for joining us.
You're welcome. Thank you for having me on your show.
Doctor,
and good morning from Qatar.
Oh, from Qatar. So lovely having you with us this morning. I think it's so important when we speak about dental care, it's all about a routine that you set up as a parent for your child. But maybe you can recommend at what age should parents start dental care for their babies?
Well, usually the first tooth starts erupting in the oral cavity at the age of 6 months. So this is when parents need to start seeing a dentist for just regular checkups every 6 months.
And what signs should you be looking out for when your child starts to teeth? To say, you know, when they have this or exhibit this kind of behavior, they're starting to teeth.
Well, usually the baby will start like biting or chewing on things, and they tend to, same like you're showing on the picture, they tend to chew on their fingers, on anything they see around. And sometimes you will see redness on the gums and bulging on the gums. This is an indication that the child is teething.
Now, teething, I'm sure for every parent, you know, comes with a lot of pain and discomfort for the babies. How do we then manage babies' pain, you know, while they are teething?
Well, first, parents need to understand that teething normal physiological process. Okay, every baby will go through, and the pain accompanied with it is a normal process. There's nothing to worry about, so no need to panic. What you can do, there are some natural things that you can do. Just give your child some cold or chilling fruit or vegetables to chew on. Give them something cool to chew on. Sometimes you may apply like a small cube of ice. Just make sure you wrap it in something so that it doesn't choke in the child's throat. You can also, there are some teething rings that are sold in the pharmacies that you can get. Just make sure you don't freeze them. Just put them in the fridge to make them cool.
Yeah. Now, the all-important question, when should we start brushing our baby's teeth, and how often should we be doing so?
Well, exactly. That's a very good question. The very first moment the first tooth erupts, this is when you start brushing your child's tooth. Even before teeth eruption, we advise mothers to get used to the habit of brushing their baby's teeth. But in this case, they don't use a brush. You can just use wrap a piece of gauze around your fingers, around the mother's fingers, and gently massage on the baby's gums. And when the teeth start erupting, they can use like baby toothbrush.
Very interesting. Well, Dr. Walid El-Saady is not going anywhere. Still going to be answering any of your questions. So if you do have any questions, please hop on over to our social media platforms. We're speaking about all things dental care with regards to babies and also teething, and maybe when is the best time to take them to the dentist. So weigh in on the conversation. Expresso Morning Show, SABC3. We'll see you in a moment.
It's my feel-good breakfast show.
Welcome back, everybody, to your Feel Good Breakfast Show right here on SABC3. You heard that sound, and it's time for part 2 of Baby Talk. And we're talking all things healthcare for your teeth, your baby's teeth this morning. And we are joined by international dentist Dr. Walid El-Saady this morning to continue the conversation. Thank you so much for staying with us this morning, Doctor.
You're welcome. Thank you for having me on your show.
You said earlier on it's so important to create a routine from the age of 6 months. But what if my baby doesn't allow me to brush his or her teeth? Is there any tips on maybe how we can still get the job done and maybe make it fun and interesting for them to enjoy brushing their teeth?
Teeth brushing is a habit, and it's always and like any habit, in order to get used to it, especially if you want to educate your child how to adopt a certain healthy habit, you need to make it fun for them. So we always advise the family to brush their teeth together, especially the mother. They make it fun. Usually we give the child the toothbrush and let them just play around with it, and then at the end the mother will hold the toothbrush and assist the child to brush their own teeth.
I'm at that point now with my little one, Doc, where he's literally taking the toothbrushes and brushing everything in the house, so that I'm finding toothbrushes in the toilet pot, everything. So yes, we do need to do that. We also need to make sure to watch where they actually put the toothbrushes after. But maybe with regards to the toothpaste then, what types of toothpaste are recommended for babies?
There are some baby toothpaste that are special for children. Just only the flavor is different than other toothpaste. As long as it has fluoride in it, then it is recommended.
Got it. And then how old should a child be for their very first dentist appointment? I know you said 6 months is when we start, creating a routine for them. But when they want to go to their first dental appointment, at what age would you recommend then?
The age of 6 months is just fine, as soon as the first tooth starts erupting in the oral cavity.
Okay, got it. And then now an all-important question for all moms to know about is nursing bottle decay. What is that exactly, and how do we prevent it or maybe treat that as well?
Well, this is a very common phenomenon that happens. It happens when the mother tends to give her child or feed her child milk during sleep at night. Milk has a type of sugar called lactose, and this is a very strong sugar. When the teeth are soaked in this sugar, the teeth, bacteria loves this sugar, and they start producing acids, which decays the teeth. And we see this, you would see a child or a baby at the age of 1 year old with their front teeth, all decayed and black. And usually the mothers don't understand the reason why. And actually this is the reason why. So that's why we do not recommend feeding milk to the children during sleep.
Thank you so much, Dr. Walid El-Saady, this morning for answering all our questions. It is, again, a journey with teething, and, it is painful, but you did give us all the recommendations for how we can manage that. We also have some social media comments that came through for you, one of them being from Mkize, saying, when my 10-year-old is about to lose her teeth, they crack in between and she loses 2 at the same time. Is it a matter of the toothbrush? Is it the toothpaste, or how she brushes them? She also grinds and chews them as well when she's asleep. Please, please help. So maybe you can help Mkize over there, doctor.
Okay, the normal shedding of teeth is a normal process, so it will happen. And we mentioned earlier, when children are teething, they tend to chew. So they would chew on anything, including their own teeth. So this is a normal process. Just make sure that you follow really loose. You can either pull it if you can, or if you find it painful, just take the child to the dentist. They will do it without pain.
Got it. And then we have another one from Sonwaba saying, yes, my child's teeth are smelly and also painful. What should I use, or what should I do?
Okay, when your child's teeth are smelly, look for cavities. This is a very common reason for having smelly teeth. And if there are any cavities, they need to be taken care of. Sometimes the type of food that the children eat, these are other systemic reasons, but for dental reasons, it's usually cavities.
And then we have one last, but this is not a question, this is actually just a comment from Nick Lombard saying, good morning, with making it fun and playful to brush teeth with a funky toothbrush, a dance and a song. Remember, it is all about making it fun for your little ones, and I'm sure the doctor can agree. Again, thank you so much, Dr. Walid El-Saady, joining us all the way from Qatar this morning to answer all of your questions with regard to dental care for those babies.
You're welcome. Nice to have you. Thank you.
Make it fun, but remember to always brush your teeth. Do.